Building on a long-standing partnership with the COPOLAD program, the European Union Drugs Agency, EUDA, formerly known as the EMCDDA, has been actively engaged since July 2022.
COPOLAD program is very important for the European Drugs Agency, and we are very proud that we have been there since the beginning to support the EU, the member states, and more broadly speaking, all the partner countries.
With support from an EUDA grant, EUDA is now implementing activities across all 4 key components of COPOLAD.
Component 1. Strengthening national drug observatories and early warning systems in Latin America and the Caribbean. In May 2023, the EUDA hosted the Latin American and Caribbean National Drug Observatories meeting in Lisbon. Lisbon also welcomed the largest ever gathering of the extended network of national focal points, bringing together 80 international participants from COPOLAD and other countries to exchange insights on empowering professionals in the field of drug policy and individuals who use drugs through education and training.
Buscamos que las personas sean el centro de las políticas de drogas y no solamente las sustancias sean ese centro. Creemos que finalmente debe haber políticas mucho más integrales que miren a las personas que son afectadas.
The challenges for us is to broaden our perspective and incorporate newer methodologies. The technical capacity to do that is lacking in the Caribbean, which is why partnership is very important, because it's broadening our capacity to incorporate other methodologies, which include things like wastewater analysis studies. That is where our technical capacity needs to be increased.
In January 2024, the EUDA organized a bi-regional workshop in Jamaica focused on cannabis policy evaluation, bringing together experts from across Latin America and the Caribbean. Shortly after, the EUDA supported the launch of Jamaica's Early Warning System, EWS, among other technical support initiatives. Component 2. Reducing drug demand through prevention, health, and social responses. A significant milestone was the adaptation of the European prevention curriculum to the Latin American and Caribbean context, now available in Spanish, English, and Portuguese. To support continued engagement, a virtual community of practice was created, allowing certified participants to exchange best practices. Another significant step was the launch of Evidência Viva in August 2024 in Brazil, an online platform designed to integrate evidence into practice, followed by an expert exchange on its implementation. 3 adapted mini-guides on health and social responses were also produced, addressing an action framework for developing and implementing health and social responses to drug problems, women and drugs, and cannabis. Component 3. Reducing drug supply. Key achievements included Latin American and Caribbean experts' participation in a joint course by the EUDA and the EU Agency for Law Enforcement Training, COPOL. Completion of a mapping exercise on forensic capacity in Latin America and the Caribbean, and the publication of a report on chemical concealment methods for cocaine. Lastly, Component 4, enhancing cooperation between the European Union and the community of Latin American and Caribbean states.
By fostering international cooperation and strengthening evidence-based approaches, EUDA and its partners continue to drive impactful change across Latin America and the Caribbean.
Time has come to see what are the new needs and what are the new opportunities for closer cooperation, and certainly a new opportunity for strengthening the equal level dialogue between partners from the 2 regions.
Together, we are transforming the landscape of drug policy and practice across borders.